Hello there and welcome back to the School of Surgery. My name is Benjamin Baker, I'm an academic junior doctor and I'm delighted to welcome back Miss Arrowsmith, a consultant plastic and reconstructive surgeon with a special interest in hand surgery here in Derby. Today is the second of our 4 podcasts about suturing techniques, and we've been privileged enough to have the opportunity to demonstrate these on cadaveric tissues. Today's podcast is going to cover some basic suturing techniques, the interrupted and mattress suture. So the learning outcomes for this session will be to be able to perform an interrupted and horizontal mattress suture with an instrument tie, and to be able to safely remove sutures whilst minimising the risk of infection.
Choice of suture technique. The correct choice of suture technique is the key to good results, as is the correct incision placement and gentle handling of the tissues. The choice of suture technique depends on the anatomical location of the wound, the thickness of the skin, the degree of tension required to close the skin, and the desired cosmetic result. Wound eversion is essential to minimise scar depression and maximise wound edge approximation. Interrupted sutures, advantages and disadvantages. Simple interrupted sutures are the most commonly used method of wound closure. These are as easy to place as a running suture, but have greater tensile strength and less potential to cause wound edema and impair the cutaneous circulation. Interrupted sutures also allow the surgeon to make adjustments to the alignment of the wound edges as the wound is sutured. They can be removed individually, for example if a patient develops a collection beneath a wound, unlike a running suture which would have to be removed in its entirety, allowing the wound to dehisce. However, interrupted sutures do take longer to place than a running stitch, and there is greater risk of cross-hatched marks parallel to the line of the wound if the sutures are left in for too long or placed under too much tension. Interrupted sutures with instrument tie. Ensure the wound edges are appropriately positioned. In this case, we've used skin hooks to approximate the edges. Insert the needle perpendicular to the skin and use a smooth movement to pass the needle through the tissue, rotating your wrist. The distance from the edge of the wound should correspond to the thickness of the tissue being sutured. Each suture should be passed approximately twice this distance from the last. When the incision edges are well approximated, it's appropriate to pass the suture through both edges of the skin in one smooth movement. Otherwise, the needle should be brought out into the wound and repositioned before being passed through the second skin edge. In order to perform an instrument tie, double loop one end of the suture around the needle holders, pick up the short end with the needle holder and pass it through the double loop. Repeat this, moving the instrument and your hands in opposite directions with single loops. Edema may occur following the operation, and so sutures should be placed to approximate the skin edges rather than tied too tightly. Hold the edges of the suture material together and vertically to enable a colleague to cut the suture material for you, or to cut it yourself with the suture scissors. Cut the suture material to such a length that it can be grasped for the purposes of removal, but not so long that the edges get caught in the wound. If the suture edges are cut too short, they're more likely to unravel. Lay the suture knot to one side of the wound. Insert sutures along the entire wound. All sutures should be placed at the same distance from the wound edge and the same distance apart to ensure equal tension along the length of the wound. Mattress suture. Advantages and disadvantages. The horizontal mattress suture is useful for wounds under higher tension as it provides good strength and wound eversion. It may also be used as a stay stitch to approximate wound edges and allow the placement of interrupted or subcuticular sutures. Mattress sutures can also be used to achieve wound eversion in wounds without high tension, and this can promote better wound edge approximation, leading to a more desirable cosmetic outcome. However, if tied too tightly, there is a risk of wound edge necrosis and a high risk of suture marks if they're left in for too long. Mattress suture. The mattress suture can be used to evert skin edges and approximate irregular skin edges. This is a horizontal mattress suture. Pass the needle through the skin edges as for the interrupted suture, and then reverse the needle in the needle holder and pass it back through the skin in a parallel fashion. Tie the edge of the suture with an instrument tie as for the interrupted suture. Removal of sutures. Pick up the suture by the loose ends and cut one side of the suture as close to the skin as possible. This minimises the amount of suture material that has been exposed to the outside passing through the wound. Remove the mattress suture in much the same way.
So to summarise, today we've learnt how to perform an interrupted and the horizontal mattress suture. We've learnt how to form an instrument tie, and we've also learnt how to safely remove sutures. So join us again here soon on the School of Surgery for some more podcasts. You can also find us on Facebook, but remember to pick the right School of Surgery as there are two, and you can find us on iTunes as well. We look forward to seeing you again.